What we're going to do in this short video now is just quickly go through what we suggest packing in your hospital bag.
Because we forgot to
Um,
do it earlier.
and as you know, there are no longer any visiting hours. Okay, so once you're transferred to the postnatal ward, you don't have any more people coming in who can drop stuff in for you. So what we suggest is making sure in your bag you've got your handheld maternity notes, like we said before. Remember them, really important. Wearing something loose and comfortable, what you're going to do anyway. You're not going to have your skin tight jeans on. You're going to probably have your jogging bottoms, a nice loose t-shirt, and perhaps a hoodie zip top, so something that you can take off.
And if you're being induced, you don't need to put your pyjamas or your nightie on. You can be in your joggers and your top and just lounge wear. But yeah, you don't need. And if you're in labour, you want to think of something loose and cool. So we used to say, nice like cheap Primark nightie for a fiver or something like that, or and anywhere that will do something you don't mind if it gets chucked away afterwards. But if you're going to be in the pool, you might want to wear a bikini top or a little tankini or something like that, or you might not mind not having anything on. So you know what you like. So just plan something for your labour. And after you've had your baby, you want comfy stuff. So if you're just in for the day, it doesn't really matter. But if you're in for a couple of days, maybe I'd pack a couple of changes now, wouldn't you?
Yeah, that's right. Yeah. So everything that we're going to say is always add on a little bit extra. Bringing in some food and drink for your labour, so snack bars, isotonic drinks like we spoke about earlier, having your own music. You don't need to bring in your own towels. The NHS will supply towels for you, and if you think afterwards when you go for a shower, there's going to be you're going to have a heavier type period, bleed, so there's going to be blood, so just use our towels. Don't bring in your own nice white Egyptian cotton ones. Bringing in your toiletries, making sure you've got enough toiletries. So perhaps packing the miniatures that you can get in Superdrug, Wilko's, things like that, the things that you take on holiday, because they're small, but there should be plenty for the amount of time that you're going to be in hospital for. Little shower gels, toothpaste, toothbrush. Lip balm and Vaseline, that's really good because your lips can get really dry in labour. That's really helpful. For after the birth, you're going to need clothes for you to wear, so you might just want to bring in a few pairs of pyjamas or nighties, wherever you're most comfortable in, or you might want to bring in a few joggers and lots of loose fitting t-shirts, things like that. Making sure you've got slippers or suitable footwear, because we don't allow you to go barefoot around the wards, just because there could be rogue pieces of dust, dirt, things like that might be on the floor. Making sure you bring in appropriate sanitary pads. So you don't want the nice thin ones with wings. Really, for the first few days, you're going to want those nice thick mattress type sanitary pads. Yeah, and they're longer as well, so they'll cover you at the front and they'll come right at the back as well. They're not the most comfortable to wear, but they are the best thing to wear.
And you're not going to be playing tennis, so it doesn't matter, okay, for the first
couple
of
days. Skating. Disposable knickers are always good, and making sure you bring your Bridget Jones pants in, not your thongs, okay? The thongs won't support
nice
your
big
pads, so
warmers,
nice big thick, especially if you've had a cesarean section. You're going to want things that come over where your bikini line is, so making sure you've got nice big knickers that come up to your belly, and also your pyjamas or your joggers need to come up around your belly as well. Don't bring your jeans in that you were wearing pre-pregnancy, because you won't fit into them and that depresses you even more. Making sure you've got some nice well-supported bras. Even if you're not breastfeeding, your milk comes in and it does make your breast bigger. So making sure that you've got nice supporting bra on. Or the sports bras are really good as well, because they support you all the way around. And
there's a little bit of a guide. Whatever your size is at about 38 weeks, is usually more or less is the size that you're going to be while you're breastfeeding. You're going to be bigger when your milk comes in, but I wouldn't buy a bra just to fit you for those couple of days when your milk comes in. There's no point, because it's only going to fit you, isn't it, for 2 days. So you'll just manage to squeeze yourself into the bra you normally wear. So 38 weeks is about the same size you're going to be afterwards when you're breastfeeding. So as a rough guide, okay, and just get one bra or so, you're not going to need a whole load of them, and then you can see as time goes by what you need then, okay, but to bring one in with you is going to be useful.
Breast pads, even if you're not breastfeeding, your breast will probably leak a little bit. So if you know any people that have just had a baby that might have some spare, or just packing a small pack of those
There's the
into
cloth
your
ones as
bag.
well, isn't there, that you can wash, you know, so you can get whichever ones you like.
And for baby, if you pack as if you're going to be staying in for a couple of days, worst case scenario, so you pack in vests, baby grows, a hat, you might want to bring your own blankets in,
Some scratch mittens, little socks
mats,
are handy.
and a cardigan, or a cardigan and a hat then.
And a pack of
bringing
nappies,
babies
a
home.
pack of newborn nappies. You will be going through between 8 and 12 nappies in 24 hours. So if you're in for a couple of days, you're going to need some more nappies. And the hospital, I think, has got some little extras for people who run out. But to have your own is probably advisable, I would.
And a bag of cotton wool, just for changing baby's bum. They do advise not using wet wipes straight away on baby's bottoms. So what we say is just getting a bowl of warm water from the ward and using cotton wool to clean baby, and then drying baby off fully before you pop the nappy on. The other thing that we've just got to remind you of is when you are discharged from the hospital and go home, we do advise not taking baby's bands off until either we can video call you and check the baby's bands numbers on yours and baby's bands, or if you do take them off, when we come out to do the newborn screening and the weigh, and we'll ask to check for them then. So please don't pop them in the bin. We need to check yours and your baby's bands when we come home, just to make sure that you haven't swapped that well-behaved baby on your right for your screaming little baby on the left, okay? I think that's about it. I hope you found them really useful. And we do appreciate all the comments that we had for the antenatal class that we put on earlier, and we do like reading them and your remarks. And if there's anything else you can think of that we haven't covered, if you want to drop us a line on the website, then we can get back to you as soon as we see them.
And enjoy your babies. And there's some really nice feedback on there from couples that have had babies already in the system as it is now with the COVID-19 situation, and it's been really positive. It's maybe not been ideal, maybe not how you plan things, but there's been some really positive feedback. So enjoy your babies, don't worry too much about it. I'm sure it will be fine. There's plenty of staff in the hospital to give you help and support as you need it. And then the community teams as well are there at the end of the phone, and we are still doing visits for that heel prick test when your baby's about 5 days old. But enjoy and take care. Bye for now.